interview with Dr. Veena Babu. She's a GP who's just literally finished 2 weeks ago and had a bit of contact throughout her GP training. And I'm really grateful that she's come on board today because we're going to talk about some of the things that don't often get talked about in GP training, struggles, exams, coming back from defeat, all those kind of things that I think you're going to get some real value out of. So thank you so much, Veena, for joining us today.
No, thank you. And thank you for having me. And I hope the story helps even one person.
It's going to help a lot of people, I'm sure. And just remind me, when did we first meet? It's been about nearly a year, isn't it? I think something like that, first meet. And this was back in AKT days.
Yeah.
Tell me about your journey very briefly in GP training. When did it start? When did it finish? Exams? What's been the journey so far?
Okay, so I went straight after F1, F2, went into GP training, and I met you, I think, in January when I was doing the Jan sitting, which unfortunately failed by 2 or 3%. And then the plan was to do the April sitting with CSA around that time. But then with COVID, exams kept getting cancelled and moved and cancelled. So eventually I did the July RCA and did the August AKT just now. So both within 2 months. And then they extended my training by a month and a week or something. So I just, as soon as I finished exams, I then passed.
And you literally finished, you come out of training 2 weeks ago.
2 weeks ago, yeah.
Have you done your first clinic as a GP yet, or are you giving a bit of a break?
No, not yet. I'm just finding my feet at the moment, yeah.
Take some time out. But two things you said that I want to try and pick up on. Number one, the exam taking, failing, coming back and resitting and passing, and also changes that you weren't expecting, right? You said that you had your CSA cancelled, etc. And dealing with both of those things, I see this on a day-to-day basis when it comes to GP trainees. They're tough to deal with. Like, you've got a lot of stuff to deal with anyway, portfolios and doing your day-to-day work. But then trying to deal with A, not getting through an exam, and then B, sudden changes in things like dates that you can't control. Those are two massive things that a lot of trainees will struggle with. And it'll be interesting to know what you went through, where your mind was, how you got yourself back on track, and how you jumped over these two really big hurdles. And you did both assessments, obviously the newer RCA assessment, but you did both within a period of, how long was it?
2 months. So July RCA and then August AKT, yeah.
Okay, and that's something I want to pick up on as well, because I often get asked questions, and I know you are going through this dilemma as well at the time. You know, is it right to do two things together, and what's the right gap, and should I delay one to go into extensions? And that's the kind of query that comes up again and again and again in GP training. So I want to go through your mind at that point and just see what led you to do what you did and what was going through your mind in terms of the alternatives at that point as well. So let's start with AKT then, because that's the one that I know you from, and I remember meeting you on the course back in Jan. And at that time, I remember you seeming on top of it. You seemed like you knew what you were doing. You seemed like you were putting the work in. It sounded like you were on track to getting a really good pass. How were you at that point? When you went into that first AKT, where was your mind? Did you think that this is an exam that I'm okay with, I'm ready, I'm good to go? Or did you have doubts before?
No, I don't think you ever really feel like that for any exam, especially something like the applied knowledge test, because it's not direct questions. You have to kind of apply, right? No, I wasn't as prepared as I should have been in hindsight. The course was amazing, and I still remember the way the questions were being asked was not in the direct way that you see in question banks. So I remember thinking, okay, we need to make sure you know each of these topics inside out. But I think now, having gone through the whole process and looking back, I'm going to be honest, it was really, really stressful, especially someone who's, I'm sure a lot of doctors can relate to this. When you're not used to failing, you're used to being type A personalities, being in control of things, knowing plans and liking, knowing what falls in place where, then all of a sudden this happening and not knowing where to pick up from and figuring it out. Yeah. I think mindset is a big, big thing. And I have to be honest and say, I was short of that a lot of times, where you really question yourself, like, is it me? Am I not good enough? Am I just stupid? But then you really have to take a minute and just realize lots of people have been through it and lots of people have failed, and it's just an exam, and we've done exams our whole life and we can get through it. Yeah. Like, a lot of it is mindset and technique and just seeing where you went wrong. So yeah, it really did affect me when that happened, when I failed it in Jan. And then having failed that, I was like, now I need to prepare for CSA, because that was then before the next reset of AKT. And then that April AKT got cancelled. So I guess I was studying for it from Jan slowly, even though I'd stopped for a few months. So although I did both exams in 2 months,
Yeah.
I guess the background work had started.
Yeah.
So it wasn't completely like starting from scratch. Yeah.
We'll
So
definitely get on to how you juggle two different things together and how you got from one frame of mind to another, because I think that's really important as well, switching from one thing to
yeah,
another.
but they're different, aren't they? Yeah, yeah, yeah. No, definitely.
Same knowledge, but tested in a completely different way, of course, and being looked at from a different angle. But let's stick with this January exam, because I think this is really important. You did this, I presume you're the kind of person that hasn't failed many things in the past.
Yeah, I know failure is important, and it has taught me a lot in life, failing at other projects or other things, but not exams as per se, no.
So you flew through exams, med school, no problem, got into GP training, no problem.
Yeah, no, because, and I think it's because I'm a creative person and I create a lot on the side. I used to always say to students before, you know, in the creative world, the amount of effort you put in does not always equate to the success. Whereas with academics, what you see is that if you put the work in, it's very rare not to get the result, you know? So this completely went against all of that because you thought you'd done what you were meant to do. But in hindsight, you know, I did take some time off in Christmas, and I should have maybe worked a bit harder, and I could have done things a lot better in hindsight. Yeah.
But I think, and that's where the AKT gets so many people, because people put the hours in. I see people do hundreds of hours in preparation for an exam like AKT and still don't get across the line, because you can know everything in the world, but if your technique is not right, if you're doing the same mistakes again and again, not because of a clinical lack of knowledge, but because of technique, then people fall down often, and it can be really, really hard to deal with it. So let's look back to that AKT day in January, the exam day itself. When you came out of that exam in Jan, what did you feel? Did you feel like that was okay? Did you feel it went badly? Went okay? Where was your mind at that point?
I think a lot of us know, right, when you come out. I had a strong feeling it was going to be close. I was like, V, for you pass this, you've scraped this. Okay. Yeah, I had a feeling it was going to be close. I didn't run out of time. I had enough time, but there were a lot of things that was between two. Yeah. And I knew that shouldn't have happened as much. Yeah, so I knew when I walked out, oh, this is not good. Yeah.
Okay, fine. So when you got the result, because it's about 2 weeks, isn't it? I think you have to wait roughly 2-3 weeks.
It was a month back then.
That month, okay. So how were you in that period? Did you forget about it? Were you able to shut off, or was it on your mind?
I don't think you can, especially when you're waiting on it and you're about to CCT soon and all this. You can't really forget about it. It was sleepless nights. I had a lot of anxiety. I'm not going to lie to you. You know, I had palpitations here and there. I couldn't really focus on anything else as much. And I remember getting the result. I had just finished clinic. It was after 5. And I just saw it, and I don't know, you just sink in your chair, and I remember tears down my face. And it was more just, oh, you should have just worked a little bit harder, just because it was a few marks or whatever. So it does hit you, yeah.
And it's often hardest when it's a few marks. Okay, say you fail by 10-20%, you can almost say, okay, you know what, fair enough, I was miles away, and I need to pick up. When it's like 1-2-3%, I mean, that's a few marks here or there. That is hard. Like, that is really hard to take, and I'm not surprised it hit you. And how did it hit you? Like, how much did it hit you? What were you like in the next few days, weeks? You were back at work the next day, I presume.
Yeah, it was more just because there wasn't much time to sit and feel sorry for yourself. If I'm honest, I'm just being honest, because I'm very much a plan action, go person. So it was more, one of my really good friends was like, you know, take a day, just feel it, be angry, and then tomorrow. And I was like, no, I don't have time for that. We're meeting for CSA practice this evening. So it was because of my tight timelines of exams after exams, I didn't have much time to sit there and kind of process it all too much. But every now and again, it would hit you. Or when you were practicing for CSA, you would say certain things and you'd be like, oh, you know, the voice in your head would be like, oh, but what do you know? You failed, you know? And that happens. And I was like, what is this voice? Where did this come from? So it does happen. And you really start questioning your ability. Yeah.
So what job were you doing at the time? Were you in GP at the time?
Yeah, it was ST3. Yeah.
January, of course, because you were August to August, and you're Jan. Fine. So was the plan always to leave both exams to ST3 anyway?
Yeah.
Yeah. Okay. So that was always a deliberate plan, because that's often something that people think, well, am I going to leave myself too pressurized in that ST3 year? Should I just try and get AKT out of the way? Like, did that come into your mind at any point? And did you think back, and, you know, I should have done this in ST2 when you didn't get through it first time in ST3?
I'm not sure because I had really busy jobs in ST2. I was in peds and acute med, and I don't think I would have had enough time and things. And I had a lot of external projects going on at the time. And some people had told me it's really good to get them done close to each other because it will really help with your CSA and everything. And I have to say, it really did. Even with RCA, just knowing guidelines much better, you could just formulate management plans a lot easier. So it did help. And I don't think I would have done it in SC2 and 3, if I'm honest, because I work a lot. I work really much better under pressure, and I like kind of working that way. But I would have worked differently the first time round.
Yeah.
I underestimated the exam, and I think a lot of people may do if you're used to. I think what you forget is maybe in med school the pass mark used to be 50 or 55, 60, but now the pass mark's a lot higher. And you just need to know that exam really well, isn't it? So in hindsight, that's why I always tell people now, don't underestimate the exam. But I still think it's doable in the same year.
Yeah, it's human nature, isn't it? When you haven't done something and you see that most people get through,
Yeah.
you think, well, actually, I'll get through. As long as I put the time in, put the work in, I'll
Yeah.
get through. Even if I'm a crammer, I'll just cram it, I'll be fine. But that's just the way human nature is, isn't it? But the thing that, going back to the ST2, ST3, taking the AKT or not, the thing that was important that you said there is that you had a plan and you knew that that was right for me. It wasn't just, well, I was scared to do it in ST2 and that's why I left it to ST3. Or I didn't feel, you actually knew that, okay, I've got busy jobs and it's probably not going to work here, so I'm going to do it in ST3. So that's the right way to go about it. Whether you make the decision to do them both in ST3 or whether you make the decision to do AKT in ST2, you've just got to know that's right for you, as opposed to go with what everybody else says.
Yeah.
Not an opinion this way, that way, but you've got to know why you're making that decision. It sounds like you did.
Definitely, because I had friends who had children and, they had to plan way in advance because they had to, all the other things that they had to do. So yeah, definitely. You had to kind of know what fits your life and your plan. Yeah.
Okay. So tell me, just sticking on January then, what was the basis of your preparation? Was it mainly question banks? Was it going through material? I know you came on our course, but what was the basis of the number of hours of work that you did?
Yeah, I went through PassMed at the bank, but I think I was going through it wrong, and I'll tell you why. So I went through that, I went to your course, and that was about it. I think I listened to some of the RCGP podcasts, but I didn't do, and I read through CKS here or there for certain common conditions. But when I was going through PassMed, for some reason, the focus was on the number of questions and not, even if you do 10 questions, understanding the information underneath and knowing those guidelines. So that's where I was going wrong. Yeah.
And we see this a lot. When people do AKT, generally 90% of work is through question banks.
Yeah.
And you've got to do that because you've got to keep your brain problem solving, but there's also a lot of information that you've got to get in there as well, and question banks can't cover everything. So you often go into an exam and there are gaps there because, there's, for whatever reason, we haven't covered enough material. And we're interested to know how that changed for your second attempt and whether you kept to the same style of preparation or whether you changed it in any way.
I changed everything. I changed everything. This reminded me of when I applied to med school back when I was 18 or whatever. I walked out of the interview knowing I'd screwed it up and I didn't get it. Yeah. Then I took a gap year and reapplied and did everything the other way around and got all my offers. So it reminded me of that actually. And it was one of the videos you had on YouTube that said, every session you go in, like, that hyper-focused nature you kind of need to be in with dividing your time up. If you're going to do 2 hours, do 1 hour reading and 1 hour questions. So I think that was really useful. And I really kind of stuck to that, not ending up with hours of reading or hours of questions and not understanding. So I really kept that as the basis. But I turned the whole thing around. I used this thing called Notion.com. It was really useful in like setting up a plan, putting notes in a place, because you can have toggles, you can have kind of, you can copy and paste a lot of things, set a more realistic plan. I just went through PassMed once this time, but very slowly, used the RCGP resources a lot more. I went on your course. I think the big difference was what I was learning this time. I was kind of doing it properly. I wasn't trying to rush. It was more at a steady pace, and I just was sticking to the plan.
So the key thing is there, you changed your plan, which is really important.
Oh yeah, completely. Because it didn't work, right? So I had to go back to the books.
Absolutely. And the first thing you've got to think about when you don't pass an exam is, yes, you can blame the system, you can blame the exam, you can blame whatever you want. But if you just go and do the same thing again and expect something different on the other end, it's probably not going to happen. So the strength that you showed is that you were able to say, okay, look, the first time, obviously what I did wasn't right. I've got to look at this and do something differently. Because what I often see with people who struggle to pass an exam is that they just think, well, it was luck, so I'll just carry on doing more, and this time I'll get luckier. And
Mm.
obviously, if you're not filling in gaps that you didn't have before, even if you work harder, it doesn't mean that you're going to change the result. So it was credit to you that you were able to say, you know what, I need to change what I did last time. I'm not just going to stick and think I'm right. I did it right last time. It was just luck. You actually put some actions in, and you're right. The thing we often talk about is 50-50 or 40-60, but have some proportion of time put to questions and have some proportion of time put to building up your knowledge base. Because if you just do one or the other, you're going to struggle in one aspect. So that was really good.
Yeah, and I think it was also something you said, start with your weakest points. Because cardiology for me was always like harder than the others. So I started with that. So once that's done, then you can look forward to all the things you enjoy. So that was really useful as well, starting with the areas that are weaker. And yeah, just being smart about it, because if something's a common topic, not leaving that till the end.
Yeah. And that's a huge point for people who are preparing for an exam. First time, second time, third time, doesn't matter. Don't leave your most dreaded things to the end, because it's on your shoulder. It's like, I've got to do cardiology, I've got to do cardiology, I've got to do cardiology. It gets put off and put off and put off, and then you probably don't have enough time to do it anyway. Yeah. So that was really good. Flip it around. Do the horrible stuff first. Do the stats. Do the admin. Whatever it is you don't like, do it first. So it's really good that you took that on board. So that's some of the strategies that you use. But where was your mindset in all of this? Like, okay, you were doing the work. You're putting the hours in. You're going through things. What's your mind telling you? Is it telling you that, okay, this time's going to be different, or is it telling you, you know what if it happens again?
Oh, it was constant fear. I have to be honest. So like, I believe in God, I'm Christian, and faith was a big part of kind of keeping me going. And I had, a very good close set of friends who kind of kept me going and had more belief in me than I ever did, and my education supervisor. But I'd be lying if I said, you constantly have that voice in the back of your head of, what if this is not good enough? What if you're not good enough? What if you fail again? What if, and it's horrible. And I'd never heard this before. And it's crazy. And I think you have to silence that with just getting on with work. You can either sit there having a conversation with this voice, but it's true. You just have to kind of direct that into work, I think. And I know a lot of people use either Pomodoro techniques or, all these other techniques of chunks of work. So I try to do it in like blocks of hours, so like 2 or 3, phone away, everything away, and having everything in one place so I do not have to get up for those 2 or 3 hours. And yeah, that's how I try to just focus my time. So all these thoughts that would come, I would just kind of silence it and just get on with work.
Yeah, and that's hard. Like, just to silence it is hard. Like, so you either just,
because I think there would be time, don't get me wrong, I'm sure there were times where it became overwhelming, especially because I was trying to revise for both exams.
right.
And it was a lot, because you're trying to practice and remember guidelines and do this, and everyone else is a lot more relaxed because they've done it, and good for them, right? Because obviously they've gone through it and they put the work in. And I think it was also that reality check of, you chose this. So I had to tell myself, like, you chose to put yourself in the situation, SC3, should have worked harder in Jan. So it was also a lot of real talk of, I keep using the phrase pity party, but there was no time to do that. It was like, you have a few months, you just need to, kind of use the time and get on with it. Because I think there are enough people out there who already question you and, all of this. You can't be one of those people. You have to kind of believe. Yeah.
Perspective, isn't it? And trying to, and again, the term perspective is banded around a lot. Just put it in perspective. It's just an exam. You'll be fine. But you've got to make perspective work for you. You've got to look backwards and tell yourself, look, how many exams have I passed? Like, if this is not going to be the exam that stops me, because I've got through so many others. And then the future perspective, like, it's only a few months I'm going to be a GP. So just keep
pushing it. Saying that, right? When you're in that position, it doesn't mean anything, because you're just like
ramming it in.
Yeah, because you remember that, you relive all of the things you got wrong, you relive opening the results, you relive all of that, and you're like, oh, I cannot be going through that again. Yeah.
It's not easy, and you have to put a smile on your face and do what you have to do in real life, and you have to go and do your clinics and your jobs and everything else, and but it's hard, because inside you're thinking, I've got this wall in front of me, and I've got to, again, what if I don't get it through this time, etc. But how are you? I mean, everything else in life, in your work, for example, could you put it behind you and kind of get on with your work day and then come back to AKT CSA, or was it there all day constantly?
It kind of was there. So if there was a patient that was interesting, I'll try and like read up around it, or keep do 4 or 5 questions in the middle here or there. But then I realized, you're killing yourself. This is not worth anything. So I would try and just enjoy the day at work, because I used to, back when we could see patients, I used to enjoy it a lot. So yeah, I tried to just focus on enjoying that. And as soon as you come home, taking a bit of unwinding time and then getting on with it. It was exhausting, but you kind of have to do it, right? Like, and I think it's I think it's what you told me, Aman, once, the whole, it's fully possible. And I know I keep saying this, but just having somebody there who is kind of like a senior mentor, believing in you without knowing your story, without knowing anything about you, just saying those words to you, it's crazy how much it does. And I was like, okay, if he said it, it must be possible. I have to just keep going, because it's true, because there was no room to have pity or sympathy or sorrow. Do you know what I mean? It was more just plan of action, just make a plan and get on with it.
Yeah,
So I think at times like this, with all this uncertainty, I think you need a bit of tough love.
yeah.
Yeah.
And sympathy for yourself, and taking time out and all that sort of stuff is really important. It's just compartmentalizing it. Okay, I'm going to do this for a couple of hours and then I'm back on it for a couple of hours. Because if you're not careful, what can happen is it takes up days, weeks, months, and then it gets really hard to get back on it. So it's really good how you use time chunks. Like time blocks are so powerful, because when you say, look, the next 2 hours is this, you almost give yourself license to, after that, do whatever you want, go back to how you want to feel. But this 2 hours is, I'm on, like, this is it. This is my time now. So that time frame thing is so important. And we talk about even going down to 15 minutes, like next 15 minutes, I'm going to work. Next 15 minutes, I'm going to work. So you have so many little timestamps in your day that just keep pulling you through, as opposed to saying, right, I've got 6 hours today, I've got to work for 6 hours. Like, that's really hard to get.
And it gets diluted, and the quality of work dissipates as the day goes on. And I can fully guarantee and say that, because you can put 10 hours in, but are you really focused for those 10 hours? I don't know. Yeah.
It's interesting what you said about your phone and putting that away, because it's such a powerful distractor, and we don't think it is. It's just sitting on your desk, but every few minutes you look at it and see a notification or whatever. And I guess you didn't do that the first time, right? I guess you didn't have your phone put away for 2 hours.
No, I wasn't as disciplined at all. And I have to be honest, like I said, I underestimated the exam, and I just thought if I put the work in, I'll be okay. But I wasn't. So it was a really good learning curve. No, I had to bring the discipline out, because it was either this time or I had to then extend my training, and I didn't want to. So yeah.
And I think that was a great move, because it's amazing how much your brain is distracted by little things. And you've got a huge social media following. We'll talk about that a little bit later on, the other side of what you do. So your social media is pinging, no doubt, all the time. So if you're constantly looking at it, it's just going to starve your mind of concentration.
And I think subconsciously we leave our phone there because we want to be distracted too. Like, oh, if someone calls, or if someone, so me and one of my friends who we used to study together, we decide like 6 p.m. So when we'd taken our time off on the weekends at 6 p.m., we'd check in with each other and see what we'd done. Or so we'd have a time where we could call each other. So I'm not disturbing her, she's not disturbing me. So that was really useful. So you had something to work towards, and like, oh, well, what am I going to tell her? I have to get on with this, or laugh at me.
That's the accountability thing, and we talk about this. You've got to be accountable to somebody, because we are too weak to be accountable to ourselves sometimes. So we may say, I want to do X number of hours, but because it's only us that we're being accountable for, we just slack a little bit. Whereas when you're accountable to somebody else, whether it's family, friends, whoever, you've got to make an excuse if you haven't done anything by that time. So you push yourself to do it. So having that buddy system, having that person, that 6 p.m. check-in, whatever it is, that is so important. And it plays a huge part in pushing yourself that extra 10, 15% every day that, builds up and compounds in terms of confidence and also knowledge in it as well. So I think it was, huge credit to you to come back from exam, because it's not easy. And when people fail exams, it can be super, super tough to come back, and super tough to accept that I've got to change what I'm doing because it didn't work first. I've got to do something different, because it's not hard to do that. Medics, we're proud people, and we think what we're doing is right, but to change that and to put in a proper plan and get through was really good. As well as for going through the fact that your other exam was changing every week. Like, you were praying for CSA, you mentioned, and then suddenly CSA got cancelled, and then suddenly a whole new different assessment comes about. Like, how do you deal with that? Because changing, things that you've been almost preparing for 3 years, I've got CSA to come eventually. Suddenly it will change.
It's funny, I'm just looking at my wall. I'd written, one day at a time, you can do this. It was like these motivational quotes, because it got to a point where we could only focus on one day at a time. There were talks of maybe you won't have to sit AKT at all. Maybe you have to do some e-portfolio stuff. There was so much speculation. Everyone had an idea. Our PDs didn't know what was going on. No one knew what was going on. And once they announced this last CA, I had decided I need to do that first sitting of the exam, because I'm not going to do AKT and then try and maneuver around this new exam. So, because you'd prepared for CSA, and my CSA got cancelled 3 days before. So that one I was ready to sit. So it was very kind of, do we keep practicing in those 2 months of lockdown? Because we were still going to work and everything. We had to decide, should we practice, should we not? So we decided not to. We decided to just kind of get on with other things. But yes, it was a lot of uncertainty. And I think in times like that, when it's not in your control, I think it's two faceted. One, everyone is in the same position. It's not just you. Every single one is. And two, you can only deal with one day at a time. So it's like, today I'm just going to get on with my AKT stuff, with the RCA, whatever happens will happen. And once they did release it, the college were really good, I guess. They did give us guidelines as quickly as possible. The platform was really good. Yeah, we just kind of got on with it. Yeah.
Well, I remember that time and the amount of messages I used to get every day saying, do you know what's happening? Do you know any news about this? What is this new assessment? And there's so much, as you say, uncertainty.
It's so much uncertainty, yeah. And I think you had given me the number of, I think there were 400 or 500 people in the ST3 year who still needed to do 2 exams in the whole country. And I was one of them. And I was like, oh my God, at that point you think, I wish I had done it a bit earlier and just got this done so I could enjoy this exam. But in hindsight, I'm glad I did it together.
But just coming back to that uncertainty, because it's not a little thing to be able to prepare for 2 assessments amongst so much uncertainty. And this is just your exam life. There's work life, there's home life, there's other stuff going on. And not having that clarity and the way that you again talked about almost chunking things down to one day at a time is so, so important. Because sometimes when you look at the bigger picture, you look at everything, you look at the distance, it all seems so vague and it's so hard to focus on the now for the next 60 minutes. Whereas chunking it down to a day or an hour or whatever it might be is the only thing you can do. It sounds like you use that tactic really well. Otherwise, it just gets too much.
Yeah, no, there was no other, we physically couldn't, I don't think. It wasn't just me. Everyone was just kind of panicking and stressing and yeah.
So panic and stress is a given, right? When you that much uncertainty, people are going to panic and stress, but it's who can compartmentalize it still and try and focus on whatever is focusable. And it sounds like that's what you did. And I know a lot of people really struggled with that COVID period and they still are, because it's still ongoing and there's still uncertainty around. It's a bit more clear than it was obviously a few months ago, but which makes your achievement even more impressive. So then you switch to RCA and you get the RCA result, you pass that. What did that do for your mindset in terms of AKT then?
Oh my God, it was the first thing I passed all year. It's like, I was like, I told my, because I passed, I think I got 78% or something converted to percent. It was did quite well. And my ES, bless her, she was so happy for me. And she was, such a encouraging person. And I remember telling my PD, it's the first thing I passed this year. And it does kind of boost you. And then you realize, oh my God, maybe you're not stupid and maybe you can do things. And it's fully mind over matter, isn't it? Because I got that result and I was then, I think, 4 or 5 weeks from the AKT. So yeah, it was really encouraging. So then I took a day to just celebrate. I didn't take a day to feel sorry for myself when I failed, but I took a day to just kind of be happy about it and then just got on with it again. Yeah. But it did do a lot. It was a big boost. Yeah.
And the other question often people have is, okay, I've taken AKT once, twice, 3 times, I've not got through it. Is it worth me switching and trying to do CSA or now RCA? And that's a great example of sometimes how switching and getting through something else can put you back on track for the thing that got you in the first place. And it sounds like that push that you got with RCA really helped with AKT. Obviously, you still have to do loads of work, and you did, and you put loads of more time in. But just that little mind shift that, okay, I can pass something in ST3, like you said, like I've done it. There's one more to go, and then I'm there.
Yeah,
and really helps. So then you fully focused on AKT for the last month. We've talked about the strategies that you did. What about leading up to the exam? Were those doubts coming back in, or were you ready for it, do you think, when it came around second time?
No, I think by that time that voice would try come back again. But I think you've been through so much by that point, 6 months of exams moving around the college, there was so much going on. There was no room for it. I think I have to be honest. It was one of those, it wasn't if I'll pass. It was more, how well am I going to pass? And I don't mean to sound cocky, but I was telling my friend, that's how we need to start thinking, rather than this whole, am I going to scrape a pass mentality? We've done it before. We've done the exam before. It's more, how well are we going to pass? what are we going to do that can kind of fill those gaps? How are we going to be well rested the day before? What are we, it was more strategy. And I think the more you read, the more you study, that confidence just comes, because you can then answer questions and you don't need to think as hard, and things kind of fall in place, and all that work in those last few weeks start to settle in a bit, I think.
Yeah.
Don't get me wrong, you still don't feel like really confident. Like I know boys feel a lot more confident by nature compared to girls, but
I don't know about that. I've seen both ways.
yeah, but for the exams, I think generally, yeah, maybe obviously you've seen more people, maybe you're right.
Yeah. It can work both ways for sure.
Yeah.
But aiming for that 100%, we talk about this a lot. Aim for 100%. Don't aim to pass. Aim for 100%.
Oh no, I wasn't aiming for 100, but it was more
No.
just failing was just not. I think it was not an option. I think that's what it was. Yeah.
Yeah, but that's important. And when we say aim for 100%, everyone knows you're not going to get 100%. But it's that mindset thing. Like there are 100, there are 200 marks out there. Why am I going to give any? Why am I only aiming for 85? Like why? Like, why am I giving 15% away? That's just telling your brain that, okay, when I get to 50-50, I can let this one go because I'm allowed to get 15% wrong.
Yeah.
But if you aim for 100, you push that extra bit for every single question. You make yourself think it through a little bit more. So that aiming is really important. If you aim to pass, like I just want to scrape it, I just want to get enough. When the beginning of one of our courses, the first thing we always ask is, okay, the average pass mark is this. What are you aiming for? And most people will say 2% above pass mark. Like, I just want to pass. And already you're kind of setting the ceiling lower. So you're subconsciously going to probably give up a question or two because you're not going to push yourself through it. So that belief that you went into, that it's not possible to fail, I'm aiming to do as well as I can, is crucial, because it does push you that little extra 1 or 2% to try and get those extra 1 or 2% in the bag, which ultimately makes a big difference.
Yeah.
That was really important. And our hashtag, Campus Will Pass, this is why we keep drilling this into people, because if you don't believe that, if you don't believe that this is me, I'm going to pass it, there's no doubt I want to get through it, then your brain starts to work on those insecurities that you have. What if I don't? And well, it didn't happen last time, so what if it didn't happen this time? And then that starts cycling and being a bigger. So it's really good that you went into it with that mindset.
Yeah, because I was just going to say, because even then, my mind was like, okay, if you don't pass this, you have the October sitting, what's going to happen? And your mind starts planning a backup. And I remember one of my mentors was like, no, stop. You don't even plan for the backup. You just have to give everything into the sitting. And if you really work with that aim of failing is just not an option. So what can you do to pass? Like, have you hit every resource? Have you done everything you can? Then what is there to, I don't know, unless,
exactly that. Don't leave yourself that option of, well, it's okay if.
Yeah.
Because the moment
exactly. Because I think as soon as you give that option, you're like, oh, I can take it a bit easy. But no, I think you cannot give yourself that option. Just take that option away.
Because then you fight for every mark. Every hour becomes an hour and 10 minutes of work because you've not got that option of default.
Yeah.
And it looks like you use that to your advantage, which is really, really good. So let's talk about advice to others then, because a lot of people do fail AKT and they come to me for advice. And, it's one thing me giving the kind of stuff that we do, but let's hear it from somebody who's gone through the process, who's picked themselves back up again. What are a couple of things that you would say to people who are maybe going through the same situation as you? They've never really failed a big exam before. Everyone expected them to pass without any problem, and they haven't. What would you suggest to them?
I would say, I think first thing is it's okay. It's absolutely fine. Don't be so hard on yourself. Be kind to yourself, just as you would to a friend. It's fully mind over matter. You have to have a realistic plan and know yourself and how you work. Even what we talked about questions, I have friends who just did that and still passed. It can work for people, but know how you work and what works for you. Definitely use more than one question bank. Definitely go on a course, or use online resources these days. I know yourself, on your podcasts, the questions, the practices, there's so many different variations. So really figure out what works for you and go to more than one of them, so you can really kind of exercise your brain in that way and set a realistic plan for yourself. And keep practicing questions and testing yourself, and keep checking in with yourself as well. I said I would do this. Have I reached that goal? Have I not? What am I going to change? And if I can do it, I went from 62% to 82.5%. So if I can do it, and I don't think I'm like the smartest person, out there, it's fully doable. It's hard work and kind of working efficiently. it's totally doable. So I think really believe in yourself and surround yourself with those people that believe in you. I think that's a big one, isn't it? Because personal stresses come in too.
Of course.
So
Yeah, and all those doubts
yeah.
get amplified when you've got other things going on around you.
Yeah,
Just,
and
it's just
before you know it, it's going to be over, and you're going to be on the other side, and
yeah.
it will be fun and it will be nice. Yeah.
But let me just pick that up. 20% increase, right?
Yeah, yeah.
That's huge. 40 marks. You got 40 more correct answers second time than first time. That's not a small achievement. That's a huge achievement.
Yeah, it was crazy.
That's a huge achievement. So credit to you for doing that, because it's not easy. It doesn't matter how much you tell yourself, I'm going to be okay, and I've got to do it, I've got no opportunity, I've got to pass. That level of increase showed just how much work you put in. And not just work, because there's only so many hours in a day, right? It's the attention to detail. It's the stuff that you were talking about in terms of making sure I've got things laid out in terms of chapters and categories. And it's the stuff that you have accountability with your friend every day at 6 p.m. It's the stuff that, you're blocking things down into small chunks. That's what led to the 40 extra marks, not just you working harder. Because when people fail AKT, often what they're told is just work a bit harder. So they go and just read more and more and more, or do more and more questions. But if you haven't sussed out 3 or 4 different strategies like you had, you're not going to see that 40 mark raise.
Yeah. It was really, because I think the second time when you saw the result, because that was the last thing I was waiting for to finish, because I had my ARCP and everything. And I saw pass, and he was so happy and relieved and excited. And I was like, it's over. I didn't even open to see the mark. And I was like, wait, let me just go check what I got. Yeah. And then I was like, wait, what? And I could not. I think I was laughing for ages. I couldn't believe it. I thought it was a mistake. But in hindsight, doing the exam as well, when I remember hitting the second last question and getting really excited that like, oh my God, it's the last exam I'm ever going to do. But I was like, V, finish the exam. You haven't even finished yet. How can you get excited? So it was one of those crazy adrenaline things where in hindsight, I remember finishing with half an hour to go, and like, it was a very different experience to the first time. That's so you kind of, yeah,
and that shows what planning does, and the hard work pays off. The smart work pays off, right? Not just hard work, smart work pays off. It sounds like you were really smart on what you did. One thing I often hear about people who pass AKT second time, third time, is they look back and they think, actually it was a good thing that I didn't pass the first time, because I know so much more now, and I learned so much more, and I'm a better doctor now. I don't know if that crossed your mind. It's something that I hear all the time.
Definitely, because I CCT'd like a few weeks after passing AKT and everything else. So by the end of it, at meetings at work, everyone would look to me for guidelines and numbers and figures, because I had just done the exam and it was all fresh in my mind. And I was 10 times better with patients, because I don't think I opened CKS once in the last couple of months, because everything was just there. But no, definitely. And I think overall, as personal growth as well, I think tell yourself it's like a part of your life, not the heart of it. Because I think with medicine, it often becomes self-consuming, and we all are so hard on ourselves, and it does take a big part of our lives. But kind of give yourself that space. It's fine. It's absolutely fine. It's not really the journey, it's a destination, and you're going to get there. I think that's really key, because now who cares and who is going to remember all of this, right? But it's your personal journey. So I agree with what those other people said. I'm glad it happened this way, and I came out stronger for it. But if you told me that while I was going through it, I wouldn't have believed it.
You'd be like, what are you talking about? Or, I want to get out of the way. Forget doing it and learning more. I'm going to get through that barrier. But amazing story, and you've come out the other end, and you're now 2 weeks into being a GP. Where are you going now? What's your plan? What's the next 6 months going to look like? Are you going to take time off? Are you going to enjoy this success that you've pushed yourself to get?
No, it's just exciting times. Just figuring out career and life, and just making a lot of what we call grown-up decisions. but I'm glad. I look back at the ST years and just think of how much growth came from ST1 to 3. Not just in how you look at your career, but the way you deal with patients, the way you kind of carry yourself. No, it's been great. I think now it's looking forward to all the exciting things ahead.
Yeah, and all those choices you talk about, this is what you worked for, isn't it? Like, so since med school, you've been on this kind of pedestal, and you've been going from one hurdle to another and jumping through one hoop to another, kind of being told where to go, what to do, what's next, what's coming. With now, you've earned the right to think, well, what do I want to do, and where do I want to go?
And that's crazy. You don't need to ask permission to have a week off, or to go see a dentist, or to go sort your car out. You can just, it's your time, it's your life, and you are the boss of it. And that freedom that comes from general practice, and it's amazing. I've always said this, I love this career, and the flexibility it offers, but and now you get to live it. So It's all on the other side.
So for those people who are struggling at the moment and they're in that zone of, oh, exams, and maybe didn't get through last time, and I'm giving up so much time, and I want to do this, I want to do that, and there's no time free, I can't see my family, I can't see my kids, I can't do all this stuff. What you're working for is the bigger picture, and
completely.
It's a great target to have.
Yeah, and I think that sacrifice is completely worth it, even if it is 2 or 3 months of blocking everything, all the noise, as we call it, right? That could kind of take your focus away. Of course, it's difficult, like I said, if you have children or you have your other responsibilities. But I think if you can dull out the noise and just focus, be hyper-focused on what you need to do, once it's over, it's over. And then you can just do everything else then. Yeah.
Amazing. And I think a lot of trainees who are watching this are going to hopefully get a lot of value out of this, because, you know, hopefully they'll realize that I'm not the only person that's going through this. Other people have gone through it and have come out the other end, and I can do it. And hopefully this is going to give them a lot of positivity coming out the other end. But Veena, thank you so much.
Thank you. Good luck, guys. Smash your exams.
You'll be great. Thanks, Veena, and we'll be in touch very soon.